Wow! The SB researcher told the Associated Press that Xinjiang's birth rate dropped even sharper than the population declines in the Syrian war and the genocide in Rwanda. I know this SB guy. Last time, his so-called research called every building with fencing facilities in Xinjiang a concentration camp.
It's laughable. In today's episode, we focus on the alleged genocide accusation from a few Western media outlets against China's Xinjiang Uyghur Autonomous Region. The evidence, let's see. As we sift through hundreds of media reports and research papers, we find three major arguments that go along with genocide accusation. First, the Chinese government forced Uyghur women to go through IUD insertion surgeries. Second, if women refuse to abort their pregnancies, they will be threatened with internment. Third, the birth rate in Xinjiang declined. Here is another graph showing the fertility rate of the USA from the 1980s to 2019. Does the dropping birth rate mean anything to you?
If I follow the America's logic, I would say America is committing genocide to Hispanic.
You laughed.
To examine the claims, we decided to conduct a special investigation in Xinjiang. During our trip across Xinjiang, we talked with family planning officials, obstetricians, and Uyghur families.
At Kashgar #1 People's Hospital, we talked with doctors. After examining their record of IUD surgeries this year, we find, in contrast to the Western media claim about a surge of new IUD implants, the number of their patients remains stable over recent years.
这个是上花和去花的登记本，从2021年1月1号开始登记的。
那有多少个人呢？
从2021年1月1号到现在是150左右上花病人的这种同意书。比如说他自己和他们家属签字，这个有并发症不是吗？所以我们一步一步的给他交代清楚，然后他们自愿要求的话再给他上花去花，就这样子。
The family planning clinic would have been flooded with people if the Western media's reports were true. But what I saw on the scenes was totally different. The hospital is one of the best in the region. All the clinics are very busy, but only this clinic doesn't have many people waiting in lines.
In a county-level hospital in Shache or Yakrant, we find a similar situation. Shache is one of the biggest counties in Xinjiang. The population of ethnic groups is over 90% of the total of the entire county. The number of the patients there has even declined over the years.
总共就是我说的那个错了，62、28，总共就是我们一个一个填马同意说。我数了你们。
你数吧。
好。56、56、57、58、59、60、94、95、96、97。
When we visited the hospital, we carefully verified the numbers. You can see us checking the numbers in the room, and on the first account, the doctor miscalculated. But then we checked it one by one, and finally got the right numbers.
Here we were at the Kashgar's Health Commission. Yang Yuye, the official in charge of family planning, talked to us, and our first question was the most sensitive one. We see some people of the Western media that they were forced to have an IUD in the vacation training center. Is that true?
第一呢，我们教培中心它不具备这个上去公立节育区的这种医疗条件，只是提供一些短效的这个避孕节育药具。第二个方面呢，还是我们这个群众观念的转变，因为消除了宗教极端思想的影响，绝大多数的妇女认为遵守相关的法律法规，法律观念更加强烈了，把这一个孩子教育培养成一个对社会有用的人，会更加重要。
While Western media attribute the declining birth rate to forced sterilization, more plausible explanations are like shifting cultural traditions, economic development, and easy access to birth control. In a 2016 report from Professor Li Jianxin and Chang Qingling, they demonstrated the influence of maternal education on fertility rate based on the 2010 census data. For Uyghur women who attended high school, or above. About 7% of them had 3 kids or more, versus 20% for those who didn't.
Uyghur women used to get married young and have children. Many factors accounted for this: constrained economic conditions, lack of education resources, and more importantly, extreme religious influence. But it has changed over the past few years.
应该说是2018年以前，我们喀什地区长期受宗教极端思想的影响，育龄妇女沦为这个生育的工具，她们无法自主选择生育几个孩子。18年以后，随着我们这个计划生育政策全面落实，群众呢很多都进行了就业，妇女有自己的事情干了。
We talked with some Uyghur families who opt for the IUD contraceptive method. We asked why they would not like to have more children.
以前的话嘛，我们爸爸妈妈那阵子就把孩子多生了嘛，就好。但是嘛，现在我们来说，孩子要不是生的算，我把他带出来、培养出来才能是算。
This Kashgar family is just one of the many Uyghur households who share similar views when we visited Xinjiang. Cultural shifts occurring in a population which is undergoing poverty alleviation and economic development is nothing new.
Western media try to politicize everything in Xinjiang and fail to recognize Uyghur women have the right to control their own body. A recent poll in China shows 80% of Chinese people interviewed believe that Western reports have been biased. Western reports like the one we have debunked today only worsen the trust among different people and damage the media's own reputation.